Sharon, you are muted. Please unmute yourself. Unmute yourself, Sharon.
Respected chairperson, esteemed faculty members, distinguished participants from various institutions. It's my pleasure to welcome you all to day third of the 5 days National Faculty Development Program on transforming national nursing education through effective implementation of outcome-based semester system. Yesterday, on day second, our esteemed resource person, Mrs. Sharanya Pillai ma'am, delivered insightful session on effective implementation of competency-based curriculum and mentoring nursing students for academic and clinical excellence. This session provided us an enhanced insight on engaging teaching methodologies and student-centric approaches for improving academic and clinical learning outcome in nursing education. As we continue this enriching academic journey, today's session focuses on academic evaluation in the semester system with special emphasis on examination system and assessment strategies. A renowned educationalist once said, assessment is not merely a measure of learning, it is a powerful tool that shapes learning. For today's session, we are honored to welcome highly accomplished academician, nursing educator, expert in educational evaluation system, Mrs. Ratna Dari ma'am, Associate Professor, Geetham Institute of Nursing, Geetham 𝐂𝐲𝐶 University, Visakhapatnam, Andhra Pradesh. She presently serves as examination chief at Geetham Institute of Nursing and brings extensive experience of 15 years of nursing education and assessment. Madam had completed her bachelor's and master's from 𝐁.𝐒𝐜 College of Nursing and a proud alumni of it. Ma'am has organized and conducted numerous workshop and skill training programs and also actively participated in community outreach programs focusing on maternal and child health, adolescent health, and preventive health care. She has also served as a resource person in the cervical cancer prevention and detection and awareness capacity building eco program for the nurses, demonstrating her expertise and dedication to the nursing education. Madam is also a life member of prestigious professional organization including TNAI, SOMI, and IAF. We warmly welcome you, ma'am. Dear participants, please be with us till the end of the session as we will be having a group photograph. If you have any queries and any questions, please feel free to drop them in the chat box or you can raise hand option. Ma'am, may I invite you to kindly deliver your expert session. Over to you, ma'am.
Thank you. Thank you so much, madam. Thank you for your kind introduction. So, everyone, good afternoon, everyone. So, I am pleased to be here today to share my experience, my learning, and my way of assessing my student. And specifically, I will be giving examples from child health nursing because that is my expertise. And I believe that whatever I learned, I will be able to share to you, and that this session will be helpful to you. So I will, without ado, I will start with my session. So today, while the session is going on, I will be totally revolving around the syllabus because in order to understand the assessment system which is given, because we can't do assessment on our basis, we have to totally abide to the rules and regulations given by INC. So we have to go through in and out again and again to the syllabus system. Is it okay? Am I audible? Like any disturbance is there? Okay. So I will be revolving around totally among these two syllabus books. So one is 2020's syllabus book, which is given by INC, and then again in 2022 they had revised the syllabus book, and it is the regulations revised 2022 guidelines. So I will be shuffling between these two syllabus. So I will be using the year and already the syllabus book is being shared to you all yesterday itself. So 2020 is the old version, but it is a complete version of syllabus book. 2022 is the new version, but it is having very slight content. Whatever is modified, it is being mentioned in that syllabus. So we will be moving through that. In each slide, I had kept the year in order to make it very clear that which syllabus I am referring to. So my session is today's session is examination system assessment strategies. So the topics which I will be dealing is concept, objectives, key features of academic evaluation in semester system, differences between annual and semester-based evaluation system, assessment strategies, concept of even semester and odd semester, scheme of examination, examination regulation, declaration of pass mark, and internal marks. And in internal marks, we will be learning how to calculate it, what are the criteria given by INC, and how we have to calculate. So the first topic, that is concept. So academic evaluation is a systematic process of collecting, measuring, interpreting evidence of a student's knowledge, skills, attitudes, competencies, and professional behavior to determine the extent to which the intended learning outcome has been achieved. So it is completely a systematic system. When we will go through the INC's given criteria, how the evaluation has to be done, we will understand there is a difference between theoretical, how we have to evaluate the theory, how we have to evaluate the practical, the skill, everything is being defined clearly, and that's how it makes a difference with annual batch system. So what are the objectives? To assess the achievement of prescribed learning outcome competencies, to evaluate students' knowledge, skills, application of nursing concepts, to monitor academic progress, to continuous and end semester assessments, to assess the integration of theoretical knowledge with clinical practice, to provide a fair and objective basis for grading, promotion, and certification, to ensure that students meet the standards and requirement prescribed by Indian Nursing Council. So there are few terms which now you may not be able to understand, like continuous assessment and all those things, grading system, credit system. But I assure you that by the end of my session, third and fourth day session, you will be able to understand all these terms, and it will be very easy for all of us to again do our work at our area. So key features of academic evaluation. So already since 2 classes we are learning, it is a continuous and comprehensive evaluation. It is credit-based system and it is competency-based system. So then how does it differ from annual system? So the duration of assessment, it is done every 6 months. Frequency of examination. So in a year we have twice the exam will be conducted. Then continuous assessment. This is the term which we need to remember. Furthermore, also we will be talking about this in more detail. So because this continuous assessment is there, it is of greater emphasis. Learning load, because the course is, like in first day session, we heard that the course is being split into small parts, and that's why it is very easy for the student to understand. It is a credit-based system, and it is competency assessment is being done. That is focuses on competency-based learning, skill acquisition, and continuous evaluation of clinical performance. So this makes the semester system more preferred for present generation. So what are the assessment strategies? So we have competency-based assessment. We have formative assessment. Throughout the commencement of semester, we assess the student in the form of sectional examination, assignments, continuous assessment. Again, I am telling you this continuous assessment, we will be talking about this in more elaboration in further more slides. Then we have seminars, case studies, skill demonstration, or skills, clinical evaluation, and bios. All these are a form of formative assessment which is being done through the semester system. Then we have summative assessment. Of course, this is done at the end of the semester. So we have end semester theory examination, that is our university examination. practical examination, internal assessment marks is also given at the end of the semester. So that also comes under summative, both for theory as well as practical, and our logbook. So that these all are the form of summative assessment which we do in semesters. So about odd semester and even semester, it is better to remember odd and even because we will be knowing our semester, but along with our semester, all the other semester will be odd only. Like suppose if it is first semester, the next year, the other semesters which will be running in that particular 6 months will be odd only. So first, third, fifth, seventh. I'm not going into detail about the subjects because it was already dealt and it will take more time. So I'm skipping that. And we know each semester have their own module according to the specialty whichever is to be dealt. Then both module mandate as well as electives are there. Then we have even semester, so it will be second, fourth, sixth, and eighth. These are considered as even semester. Again, we have modules, both elective as well as mandatory modules. So we will talk about all these, like in assessment, what is the role of mandatory modules mark and what is the role of elective modules mark. That also we will be talking about while doing assessment, where we have to keep which mark. So this is about even and odd semester. So it's good if you remember the semesters on the basis of their evenness and odd. So about scheme of examination. So this is the set of things which I have taken totally from the syllabus. The main source is the 2020 syllabus. So if you want to refer or if you want to go with me, you can turn on or you can come to the page number 238 to 241. So there is a scheme of examination which is given by INC. We blindly follow that, but if at all, like if like my university is we go upon our basis. So if I want to get it anything changed, so I need to go through our authorities. So like that it can be changed, but not completely. It should be as per INC, but slight more clarifications can be surely made. So scheme of examination. So in this we will see the distribution of marks in internal assessment and semester and also our collegiate exam. So how the marks is being distributed for internal assessment. So like in annual semester, it is also of 25 marks. So 25 is only the internal marks which is allotted by INC for theory, and for practical it is 50 marks. But there is a slight things are there which we need to remember, that I will emphasize again and again in order to just you people to register that in your mind, because it is important furthermore whenever we are dealing with the assessment. So we have subject communicative English. So the marks given like internal marks has to be given out of 25. Then end semester collegiate exam. So English is our collegiate exam. So the marks we have to get it out of 25. But when we see the question paper pattern given by INC, it is out of 50. So of course we need to divide it by 2, and the marks from out of 25 has to be sent to the university for English subject. So the paper will be of 2 hours and the total marks of 25 will be 50. So same for anatomy, physiology, 25 marks will be the internal. The question paper will be out of 75. Tomorrow we will see how the question paper or the furthermore slides also we will see how this the marks is distributed among anatomy and physiology. Question paper will be for 3 marks and the total marks will be 100. Same for our sociology and applied sociology and psychology. Then we come with the subject NF. So we need to remember that NF1, we don't have final exam in semester 1. We have final exam in semester 2. But still, we have to calculate the internal marks of NF1 regarding its semester or whatever assignments you have distributed. Like according to the logbook, the assignment is being distributed, and with the help of continuous assessment, with the help of sessional exam, we need to calculate the internal marks for NF out of 25, and we need to keep it with us. We don't need to send it to university. Only thing which we will send for semester 1 will be communicative English, applied anatomy, physiology, applied sociology, psychology marks only. NF marks need not to be sent, but we need to calculate that in the SEM 1 itself. Similarly, for NF1 practical also, we need to calculate the marks. So this star, the meaning of this star is that this NF1 marks will be merged to NF2 marks, and it will be the plus will be done. So for that I will show you in another slide. So I hope this is clear. How we have to for semester 1 what all marks need to be sent to the university and how much marks the internal marks has to be calculated out of what, that also we understood. And we understood that English exam question paper is out of 50, but end semester collegiate exams marks has to be sent out of 20. Then we have second semester.
Ma'am, your voice is not audible.
It's not audible.
Actually, it is stuck in between. Might be the network issue.
Network. Okay, okay. Ma'am, am I audible now?
Yeah.
Yeah.
Shall I continue? Shall I
Yes.
continue? Yeah.
Yeah,
Thank
yeah,
you so
please.
much. Yeah. So NF1 marks what we calculated in the previous semester. Here, that will be added, that will be merged with the NF2 marks, and it will be, in theory, it has to be divided by 2, and again, the marks will be only sent out of 25 only for theory. That we have to remember. And then 75 will be the university exam, that is 3 hours, and 100 marks will be the total. HNIT is again collegiate exam, so we remember like English how we have 25 for internal and 25 for college level exam. So that has to be done same as English. And in NF 1 and 2 practical exam, similarly 25 we calculated in semester 1, 25 we are calculating in semester 2. We have to add both of them, but we need not to divide it because practical marks has to be sent out of 50 only. So this is slight variation which we need to remember. And the practical marks has to be for university exam, the practical marks comprises of 50. So 50 plus 50 will be 100 marks. So that's how second semester examination assessment is being done. Third semester, same. Again, here we have PPG, so pharmacology, pathology. We don't have to conduct exam, university exam in third semester. This again follows the same rule as we had seen for NF1. So we will calculate the internal marks, but we will not send it to university. We will keep with us. We will add these marks to the SEM force PPT's marks. And then we will get out of 50, this 50 will be divided by 2, and out of 25, the marks has to be sent to the university in fourth semester. So that's why this is star implies that. Then we have subject adult health nursing. So you can see there are few subjects where the practical exam is conducted within that semester itself. So adult health nursing and community health nursing are the subjects where their exams is commenced in that semester itself. So their marks remains out of 50 internal marks, and end semester university exam marks out of 50, and 50 plus 50 is 100. So same, now if we will see, we will be able to understand this pattern. So here PPG I told you in third semester there is no need to send this 25 marks to the university. So that 25 and this semester, fourth semester 25 for PPG has to be added and divided by 2, and that marks has to be sent to the university. So adult health nursing is the subject that is own semester collegiate exam. So English and the HNIT professionalism follows the same rule, 25-25, and 2 hours exam paper, and 50 is the total marks. So I think that this this will help you to understand further more semesters as well. So child health 1, child health and mental health 1. Again, there is a star means only we have to calculate the internal, keep with us, no need to send. Exam will be conducted for community health nursing, education technology, and introduction to forensic. Introduction to forensic is a collegiate exam. So of course, 25 marks internal, 25 marks our college exam has to be conducted, 2 hours question paper has to be conducted, and 50 marks has to be the total will be 50 marks. Then for same follows for practical. So we have 25 for child health, 25 for mental health, because the practical will not be conducted in 5th semester, it will be conducted in 6th semester. So community health nurse 1, this practical has to be conducted. So AHN 1, AHN 2, community health nursing 1, community health nursing 2. These are the 4 subjects where exam will be conducted within that semester itself. So the internal marks has to be sent out of 50 within that semester. So we will see how they had distributed the marks also in further slide to get this 50 internal marks for these subjects also. Then, so same 6th semester child health nursing 1, 2 will be plus divided by 2, same for mental health nursing. Then we have nursing NMLE or management and leadership. So 25 marks for internal, 75 marks for end semester examination, 3 hours paper, 100 marks. Midwifery, again, like child health nursing, mental health nursing in the previous semester, it will remain dormant. I can say it will remain dormant. We don't have to send the marks to the university, but we have to follow all the instructions. We have to calculate the internals. We have to keep it with us. Then practical exam, child health, mental health. So SEM 5, SEM 6, both will be added. No need to divide. That we need to remember. And final exam will be out of 50. So 50, 50, 100. So they both remain same for child health and mental health. OBG exam will not be conducted in 6th sem. It will be conducted in 7th sem. So there we need to add this 25 there. So 7th semester, community health nursing 2, so 25 and 75. And again, community health nursing 2 is a subject which where the exam will be conducted in within that semester. So the practical exam directly out of 50 internal has to be done. Nursing research and statistics 25. Final exam will be 75, 3 hours paper, 100 marks total. Midwifery, so previous semesters 25, recent semesters 25, both added divided by 2. For theory divided by 2. For practical, no need to divide. That we need to fix in our mind. And it's okay to go back to the syllabus book, check again and again and again. There is no problem in that. Not at all a problem. It is not our final exam. It is just we want to justify our mark. We want to send clear-cut marks for the students. We don't want to have any faulty marks for the students. That is our concept here. So, community health nursing 2, 50, 50, and midwifery, previous 25, now 25, add both of that, we get 50, and the final marks of out of 50 and total will be 100. The last semester rate, it is for totally competency based, but still, even though they are in their internship, we need to develop some criteria to evaluate the student out of like continuous assessment out of 50. Then their internal exam again before they go to their final competency assessment. One practical model competency assessment can be done out of 50. Then an average 100 marks we can send as internal, 100 marks in the semester university examination. Both combined, we get 200 marks. So this is the scheme of examination given by INC. So we will just quickly brush up. I do understand I was very fast. So I'll just quickly brush up with this. So college level exam, we have 4 subjects, communicative English, we have HNIT, we have professionalism, we have forensic nursing. So all these are collegiate level exam. Question paper is out of 50, but we have to send the final marks out of 25 only, internal marks also out of 25. And the passing percentage we need to remember very clearly for only for English and elective module. Again, I am telling only for English and elective module, the passing percentage is 40%. Remaining others all means all the collegiate level exam mandatory modules as well as our other specialities and other subjects. The passing percentage is 50%. Again, very important thing which we need to remember is English marks will not be added in calculating SGPA and C. Similarly, electives marks also will not be added. Elective module marks also will not be added to while calculating the SGPA and CGPA. So tomorrow we have, I will be dealing about how to calculate SGPA and CGPA. There are 1, 2, 3 examples I had kept, and that will help us to get this thing fixed in our brain. Anyway, so these are the things which we need to remember here. For English, for elective, 40% is the passing mark. Remaining all, it is 50%, including mandatory module. So what are the subjects? So this is I divided first, the second, so color variation I gave all even semester in red, and this is black, the odd semester. So, but I had given this clarification that which exam, which subject is having a practical exam after 2 semesters. So first semester we have anatomy, physiology, applied sociology, psychology. Second semester applied biochemistry and applied nutrition and dietetics. But the NF exam will be conducted after 2 semesters. Similarly, we have in third semester applied microbiology and infection control, including safety. Then we have adult health nursing, adult health nursing, adult health nursing 1, 2, community health nursing 1, 2. Both are having a practical exam within that semester itself. Then we have PPG. PPG, the subject is there in both the semesters, but the exam will be conducted after 2 semesters only. Adult health nursing 2, same semester the exam will be completed. Community health nursing also same semester exam will be conducted. Child health, mental health, after 2 semester only exam will be conducted. For management, the exam will be conducted in same semester. Community health nursing 2, research and research also same semester. Midwifery in the other semester, the exam will be commenced. So this is a quick revision of whatever we had seen there. Then we have practical exam. We don't have any practical exam in first semester. Second semester we have NF 1 and 2. We have third semester adult health nursing 1, fourth semester adult health nursing 2. We have fifth semester community health nursing 1, including environmental science and epidemiology. We have sixth semester in which we have 2 practicals, that is child health and as well as mental health nursing 1 and 2. Then we have seventh semester where we have 2 practicals, that is community health nursing 2, midwifery, obstetrics and gynecology nursing 1 and 2. Then we have 8th semester where we have to go with competency assessment. So we will talk about these things also. And then we have exam regulations. So they have distributed the marks also. We need to follow the same mark pattern. But for internal assessment, when we do the sectional exams, they have given different pattern of question paper. This pattern is for final exam, that is university exam. So applied anatomy, it should be of 37 marks. Applied physiology, 38 marks. Applied sociology, 37 marks. Applied psychology, that will be part B, 38 marks. Microbiology and infection control, in that applied microbiology will be part A and it will be 37 marks. Part B will be infection control, including safety, that will be 38 marks. So we need to make sure that our student knows this pattern. We should make sure that they understand that they need to complete all these section A, section B. So we need to feed in their brain that how will be the pattern of examination. Then fourth, this I highlighted the syllabus from 2022 because according to INC they are given slight changes. Actually, they just shuffled the name from here to there. Previous syllabus, it was nutrition was part A, but now they made the biochemistry as part A. So part A is applied biochemistry with 25 marks, and section B will be applied nutrition and dietetics with 50 marks. So we don't have to stick only with one syllabus. We need to check the other 2022 revised syllabus also in order to get the exact pattern of examination. So PPG, so we have section A of pharmacology with 38 marks, and then we have section B of pathology with 25 and genetics of 12 marks. Then we have nursing research. So nursing research should be of 55 marks and statistics should be of 20 marks. Then these rules already we are very well aware of, that the candidate should have minimum 80% attendance in theory, and irrespective of whatever kind of absentees they have given, they should have this 80%. This is mandatory. Even they have distributed the marks. They have given a weightage of, in continuous assessment, they have given weightage for this attendance. They have given 2 marks allotted only for attendance, and they have distributed how these 2 marks will be divided between 80 to 100%. So that much importance they have given. So we need to be very careful with this. So 80% should be in theory and 100% should be, attendance should be for practical. And then only the student will be eligible to appear for this or her exams. Then we have point 9. This is again, there is a change which is in 2022 revised syllabus. They had made slight changes, not a very big changes, but they have just specified like English will be of 40%, passing mark will be 40%, and other will be of 50%. So I'll read this. Following exams Following exam shall be conducted as college exam, and minimum pass is 50% except for communicative English. So we already had seen these are the 4 college level exams. So we have to conduct this exam before the student appears for his or her university. So only English, the passing mark is 40%, remaining other subject it is 50%. The marks for all the college exams listed below, alongside all other university examination, must be sent to the university for inclusion in the mark sheet and shall be considered for the calculating aggregate and ranking for awarded by the university. So all these marks has to be sent, but we need to remember, because sometimes the university will give the mark, but the student will come and calculate and come and say that I am getting more SGPA, but here in my marks it is less. Why? Because they will calculate this communicative English as well. So we need to be very clear. First of all, communicative English and electives are not included in calculating SGPA and CGPA. Remaining other all is added in calculating SGPA and CGPA. Then award of rank will not be considered for those who have one or more courses and must have completed the program by 4 years. So that is well known. So they have to clear all the exams. Otherwise, this course certificate will not be given to them. Then the mark sheet with the grades, grade points, average shall be given by the university for all the courses. For this mark sheet also, IMC had given the sample how to prepare the mark sheet. We need to strictly follow that. We can do some modification like columns and all can be reduced, but all the things which they had kept in the mark sheet, that has to be there in the mark sheet. So communicative in English and elective modules are not included for calculating semester grade point average, that is SGPA. That we have to remember. Then we have 10th point. So a minimum pass mark shall be 40 for communicative English and in each of the elective module. All the module must be completed as indicated in specified semesters, and pass marks are sent to the university before appearing for final. So this we need to be very aware, because elective module, if we send any fail mark, that again will affect the student. So we need to be very clear. We can do again a retest and we can send a final mark of pass mark. That is just 40% is the pass mark that we need to do. So this is being modified or revised in 2022 syllabus. So this point I took from the syllabus of 2022 revised syllabus. Then we have 11th point, that is minimum pass mark shall be 50 in each of the theory and practical papers separately, except in English. That also we know. Then the student has to pass in all the mandatory modules placed within courses, and the pass mark of each module is 50. So this already I emphasized this in previous points also. The mandatory module, if we have, we can decide the set criteria. We can give the marks to the student, but the marks for the student to get a passing mark, he should attain 55. That is mandatory. Then 13 point, a candidate has to pass in theory and practical separately in each of the paper, that we know very well. It was same for the annual semester also. Then 14, if the candidate is failing either a theory or a practical, he or she has to reappear for both the papers, that is theory and practice. That also remains the same like dual semester. Then if at all a student is failing in any one subject within a mark limit of 5 marks, INC gives the freedom to give this grace marks. So grace marks of up to 5 marks can be given in theory marks, and this should be only given if by giving this marks the student will pass the semester. If that surety is there, then surely this 5 marks of grace can be allotted. This is being very clear clarified by INC. So this after 15, the 16th point, there is a change in 16th point. This change is been like communicated to by INC to respective colleges in the month of January of this year itself. So this is not visible, so I had kept in the other slide also. So the old amendment used to say that there was two blocks. The two block semester was there. In fifth semester, there was a block. The students were supposed to complete all the previous semesters, that is first, second, third, and fourth, all the semester examinations before they get the eligibility to appear for fifth semester. So that means they have to clear all the previous semester, then only they will be allowed to write fifth semester. Now this point INC has changed. Actually, we suffered with this a lot. We already have a batch which is completely finished, like 8 semester is completed, and another 8 semester batch is about to go. So we faced a lot of difficulty because we had a lot of stagnation there. Fifth semester only, many of the students got stagnated because PPG, microbiology, these are very tough subjects, and they get stagnated over there. So this amendment was a very big relief for us. So now this year they all appeared for their examination. I'll read this for you. So INC has amended serial number 16.123 that permitted to attend the class till 8th semester, and the semester failed backlog papers. So paragraph 16, 1 and 2 are deleted and 16 is amended. So hence the amended para 16 will read as under: the candidate shall appear for exam in each semester. Then the third point says that the candidate shall have cleared all the previous examination before appearing for the final 8th semester examination. So now there is no two blocks. Now there is only one block, and that comes after 7 semesters only. So they can appear till 7 semester. They can appear for their previous examinations, backlogs and all, but they have to clear all the 7 semesters. Then only they are eligible to attempt the competency examination. That is our 8th semester. So fourth point says the maximum period to complete the course program successfully should not exceed 8 years. So this remains the same like an annual back. So this amendment is effective for the candidates appearing for 5th and subsequent semester of BSc Nursing with effect for the year 2025. So we were very relaxed when we were very happy when this amendment came. So we allowed the student to write for their exam. Now they are gradually clearing their pending exams. So this amendment is applicable for all the students awaiting to complete 5th and subsequent semester, irrespective of admission. So further clarification, the student should have cleared all the previous examination till 7th semester before appearing for 8th semester examination. And the internal assessment attendance requirements are completed in the previous examination. If they completed, suppose they completed their other batchmates completed 8th semester, but they are pending with other subjects, and they have to but their requirements and their attendance, they fulfilled all those things. Then there is no need to make the student to stay back in the college. We can send them home. We can only ask them to come and appear for their exams whenever the exams is scheduled by the university. That is the meaning of that is the gist of this particular point. Then regular examination are specified in the syllabus every semester, and the supplementary examination of previous semester can be planned by the university at appropriate timing in the interest of the student between semester or during the succeeding semester examination. So this INC gives the freedom how the university will plan the examination for supply students. So that totally depends on the basis of university. So it is also clarified that the student appearing for any semester exam must fulfill the internal assessment and attendance requirement of that particular semester. So this again, they are very much emphasizing that it is not that the students batch has completed the course and we can just allow them to appear for their examination. It is not at all like that. They need to complete their attendance shortage. They need to complete and they need to have their internal assessment done. Then only they will be allowed. So this they have cleared very clearly. They have stated that. And students can appear for more than one semester exams, provided they fulfill the attendance and internal assessment requirement for the semester. So whatever backlog they have, they can write at one stretch also, as the exam schedule or the timetable is scheduled. They can surely appear for that. Only condition is their attendance should be up to date. Their internal assessment also should be complete. That is the only criteria which the ILC is very strict. So that was the modification recently happened in point number 16. Now point number 17. So this also we are very well aware. We know that if a batch is having 40 students, the 40 students internal marks average score when we take, it should not exceed 75%. So that remains the same here also. So whatever criteria the ILC had given, on the basis of that, we will calculate the internal marks. Then we will do a total of all the students' marks. Then we will take the average and see it should not exceed 75% of that whole. So that is again important. Then at least 50% of non-nursing subjects like applied anatomy and physiology, applied biochemistry, applied psychology and sociology, applied microbiology, pharmacology, genetics, nutrition and dietetics, communicative English, and health and nursing informatics technology should be taught by the nursing. And the teachers who are involved in the teaching non-nursing subjects can be examiners for the program. So that also ILP clears. Now, 19 points, the regulations are for practical examination. So maximum number of candidates, because we are going with OSCE and DOP pattern of examination. So it is clearly said by INC that we should not take more than 20 students per day to conduct the practical. So we have to follow this as per INC. So maximum number of candidates for practical examination should not exceed 20 per day. Particular year and of same institution batch shall be examined by the same set of examiners. All the practical examination must be held in the respective clinical area. Like if it is child health, so of course the child health, it has to be done in the pediatric ward or even postnatal ward can be used. So in particular respective area only the practical exam has to be conducted. One internal and one external examination should jointly conduct practical examination for each. So this we already follow and we have to do that. Then 22nd points, an examiner for theory and practical OSCE examination should be an assistant professor or above in a college of nursing with MSc and preferably with minimum 3 years of teaching experience. To be examiner for nursing foundation, there is no need of any specialty. Any specialty person can be the examiner. Only condition is they should be MSc, they should be having 3 years of experience and assistant professor. So examiner for competency assessment. So this is the exam in semester 8. So we have 5 specialty. So we have to have 5 examiners. So the INC says that 2 can be external and 3 can be internal. So 2 external can be, but specialty, we need to remember the specialty. So if the external is from child health and mental health, remaining 3 internal should be from all other 3 specialties. So total 5 different specialty people should be there as an examiner. So the internal examiner may be from the college faculty or from the hospital with required qualification and experience, that is MSc nursing in respective specialty with minimum 3 years of teaching experience. So this is more specification given in 2022 revised syllabus. So even hospital faculty can also be internal for the examination, but only preferred criteria is they should be MSc and they should have minimum 3 years of teaching experience. So this is assessment guidelines. So this also is revised in 2022 syllabus. In 2020, there was like this 10 was given percentage like 100%. So such kind of changes are being made. Now they made it more clear for us. So this only we need to use to calculate the CGPA and SGPA. So this grade point only we need to follow. So we can see and not elaborating that much. And for English, we know that 40% is the English and elective, 40% is the passing. So then declaration of pass mark. So first class with distinction. So CGPA of 7.5 and above is considered as distinction. First class CGPA of 6 to 7.49 and second class CGPA of 5 to 5.9. CGPA means it is cumulative. Cumulative means all the previous SGPA, previous semester SGPA is being calculated and the student gets his total percentage. So that's why CGPA is taken into consideration and that's how they had given the grading. So tomorrow we will talk about CGPA and GPA as well. Then now this is very interesting. So we have internal marks. We will be seeing how IMCs have distributed these marks, what are the criteria to calculate and how we can calculate. So I kept a few calculations, few examples and also try to include one online like activities where I will calculate and show you. So let's see. So internal marks assessment. So distribution, we need to remember there are two important criteria on the basis of which this internal marks has to be produced. So one is continuous assessment. So we need to remember these two terms. Continuous assessment, sessional exam. So both for sessional exam means for theory it is sessional exam, for practical it is model practical exam. So like that. Continuous assessment, the marks are the marks allotted is 10. So already we had seen in the previous slides that total marks, internal marks, we have to send out of 25. So this 25 marks is divided into two things. One is continuous assessment, another one is sessional exam. So continuous assessment is out of 10 marks, 15 is for sessional exam. This continuous assessment, I'll go in more detail how this continuous assessment has to be done. Because we know sessional exam, two sessional exam has to be conducted and the average of that marks has to be brought out of 15. So this is very easy to do. This is the one which needs so much of work to be done. But once we are clear, we understood, it is very easy to go with this also. So so same for 10, 15, 10, 15, 10, 15, 10, 15 for all the subjects. So this is for first semester. For second semester also 10, 15, 10, 15, 10, 15, 10, 15. And already I told you previous NF1 25 and recent the second semester NF1 NF2 25 plus 4, both of them we need to plus, we need to divide by 2, we need to get out of 20. But in practical, we don't need to divide, we just have to let it remain as it is. Now here it changes because I told you we have 4 subjects where the practical exam has to be conducted in the same semester itself. So this is our adult health nursing 1. So where the continuous assessment it changes. So we have to do it out of 20. We need to get it out of 20. For sessional exam, we need to get the marks out of 30. So this remains same for adult health 1, adult health 2, and community health nursing 1, community health nursing 2. These are the 4 subjects where these marks changes. Others all, this remains same. One example like NF1, NF2 already 10 plus 10, 20 only. For child health nursing, 5th semester 110, another 6th semester another 10, it becomes 20 only. So here we don't have twice. So that's why we have to take it at once only. So out of 20 and 30 and 20, 30 becomes 50. So that this we have to remember again. So 4 subjects, adult health nursing 1, 2, community health nursing 1 and 2. So here only 20, 30 will be the marks distribution. So this I'm not going in much detail. So remaining all it remains same. 10, 15, 10, 15, 10, 15 for the subjects. Adult health nursing 20, 30. So here is the change came. Child health nursing remain 10, 15, mental health 10, 15 and community health nursing 10, 15. And because it is 25, only practical we have to see the marks changes. So here you see community health nursing 20, 30. So this we have to remember. That's how the marks is being distributed. We will see how this 10 is being extracted from students' assignments. So this is semester 8 where competency assessment. So we have 5 specialty. Each specialty is given 20 marks. So 20 into 5 it is 100. Then we have continuous performance evaluation. We can keep some criterias. We can have some criterias like we can like attendance. Some marks can be given. Performance of task, punctuality, even uniform, like that few criteria we can keep, and the daily assessment or weekly assessment can be done, and that marks can be evaluated here. Then we have OSCE. Before the student goes for a final OSCE, we conduct one practical OSCE, practice OSCE beforehand, and then we get marks out of 50. So 50 plus 50, 100 marks we attain like this for our internship students. So this is about mark distribution. So now I told you two criteria we need to remember. One is continuous assessment, one is our sessional exam. So for continuous assessment, again the INC. So we can see this, we can get all this in the syllabus itself. So our 2020 syllabus, page number 15, we have to go at the back of the syllabus. So I went so many times back front that it is very fitted in my brain, like for what we have to go to front, for what we have to go to back. So I may be wrong with the page number, but I know where I have to go. So that many times we have to go through the syllabus book again and again, so that we can be well versed with what is the criteria given. So continuous assessment. So we have 10 marks already. We saw in the previous slides. So it is 10 marks. How we get that 10 marks? So see, this is theory. This is for theory. Already they have given for theory as well as practical also. So attendance, I told you, very important. They have given 2 marks for attendance. Out of this 10, 2 marks is exclusively for attendance only. They have given criteria like 95 to 100% 2 marks, 90 to 94 1.5 marks, 85 to 89 1 marks, 80 to 84.5 marks. So this is how we have to give them marks. It is good to communicate this thing to students, because sometimes they become so reckless, they don't understand, they don't realize the importance of this internal assessment, they don't even think what they are losing. So we have to communicate all these things to students, so at least they can they can understand how they have to maintain their attendance. So written assignment, we can give any of the 2 assignments. So the marks can be out of 5 you can give. So 5 plus 5, 10 marks can be given, or you can give 10, 10, and you can take average out of 10. So that's up to you, whatever. For each thing, we have to keep one evaluation form. For each thing, it's better to keep evaluation form. We need to communicate that criteria to students. We need to encourage them to do their presentation, because so many things have to be completed, and it's very much like the students, specifically if it is first year, it's very difficult for them to cope with everything. So we need to communicate to them on what basis they are being evaluated, and we need to give them evaluation form so that they should know on what basis they are being evaluated. So written assignments, seminars, micro teaching, individual presentation, any of the one thing can be done. So we go with individual presentations. I give small topics to them. I ask them to present that topic, and the marks either we can take out of 12, or we can make the evaluation performance out of 12 only, and 12 plus 12, and then divided it by 2, and you get the marks out of 12. Then we have group projects, work, and reports. So for first year, I'm the class coordinator for first year right now. So I'm giving more example out of that. So for them, I gave group projects, like I gave them to do the model. So this one criteria is finished. So I kept the marks out of 6 only, because I don't want to again and again do the average thing and get things more complicated. So 6 out of 6, I got their marks. And all of these, if you will calculate, 2, 10, 12, 6, 8, the total becomes 30. But 30 has to be divided by 3, and you get your marks out of 10. If anywhere mandatory module is there, so first year there is a mandatory module, that is first aid, and that module marks out of 50, out of 25, whatever you have kept the criteria, you will get the average out of 10. That 10 will be added to this 30. So it becomes 40. So 40 has to be divided out of 4, and then we get the total marks out of 10. So that's how we do. I kept one example. It's okay if you don't understand here. We will see in the example also. So that's how we have to get the internal mark for theory. And this is not internal mark, this is only continuous assessment. For another, so continuous assessment is for 10 marks. Now another criteria is sectional exam. Sectional exams mark was out of 15 marks. So then only 10 plus 15 will be 25. So how many sectional exam we have to conduct? 2 exams. So INC is saying that only 30 marks exam you conduct. So in that you keep MCQ for 4 MCQ you keep, 1 essay you keep, 2 short note you keep, and 4 very short note 3 you keep. And total becomes your 30 marks. So 2 sectional exam, 30 into 2, that is 60, and that divided by 4 becomes 15. Or you can, even if you take average also, it comes. So this 15 plus that 10 becomes your 25. This is how we need to we need to get our internal marks for semester syllabus. So this is one example I kept. So this is for first year students, which I recently did. So now they are in second semester. So we had one sessional exam in October. We had a sessional exam in December. I calculated both of them. I got the marks out of 60. Then I got it is divided by 4, and we get out of 50. So this is the mark. This is the mark for sectional exam. So that means I got the marks out of 15. Now I have to see here only, you can see in that Excel sheet I had kept so many sheets because I don't want to struggle with finding my things. I want one thing, we can say theory marks to be found in one particular Excel sheet. So here only I kept everything, but here I kept slides, so I'm changing it. So this I got 15 marks average from sessional exam. Now this is continuous assessment. So attendance, I told you 2 marks out of 2 marks. Already INC gave the criteria. We have to see and we have to fill here. Then we have to give 2 written assignments, and we have to get the average of that 2. Then we have individual presentation. I told you I give IP. I give the topic to student. I ask them to present within 15 to within 30 minutes, and that's how I give them mark. And for my ease, I kept it out of 12 only because I don't want to get it average every time done. It gets more complicated. So then I did project work. I gave them project work. I gave them model presentation, and I kept the marks out of 6 only. I got the marks out of that. Then module is there. There was the first aid module. So that marks out of 10 I got. All this I got total. Because module is added, the total is out of 40. If module is excluded, the total will be out of 30. If it is 30, it has to be divided by 3. If it is 40, it has to be divided by 4. So total out of 10, we will get the marks. We make sure in our university that we get the signature from student because they have full right to know what is their internal mark, how we assess them, and we maintain that transparency. So we get the signature from students so that when the result comes, they should not be in panic mode and they should not make us in panic mode. So we make it sure that we get the signature from students. Then, so we got marks uh, out of 15. We got marks out of 10. Now I have to plus that 10 and that 15, and I get my marks out of 25. So this is my NF mark for semester 1, but I will not send it to university. I'll keep this with me. Now this semester again I will calculate, I will evaluate my student on the criteria, whatever INC had given. And this 25, the coming 25 I will add. I will divide it by 2 because this is theory paper, and I will send the marks out of 25 to the university. I hope I was able to make you understand. Again, I have a practice session also. In that, I'll make it more clear furthermore. So this is another criteria for practical examination. So again, for practical also we have continuous assessment and we have sectional exams. So for practical examination, they have given again weightage to attendance. So 100% attendance is there, but still they have given till 80% they have given, they have distributed how the marks can be given in clinicals also. Clinical assignments are there. So in first aid, in first year, they have assignments like in logbook. At the end of first year's logbook, it is given. They have two history taking, they have two care plan, they have two fall risk, they have two pressure course. So I divided all these things into 2 semesters. So few I had kept in first semester, few I had kept in second semester according to their syllabus. Because nursing care plan is dealt in second semester, so I can do the assignment over there. So you can do some modifications, and you can like according to students aspect, you can do the modification and get the marks. So because they had not specified which assignment has to be done in which semester. So that of course as a head we can do the model. So so those marks. So here they have given some examples like clinical presentation, 3 marks, drug presentation report, these all things. So what I do is I just whatever evaluation form we have, all the marks we will plus it, we will divide. Ultimately, I want marks out of 10, so I get the average and I get the average for this clinical. I'll show you further. Then we have continuous evaluation of clinical performance. So of course, from annual syllabus only, we are getting this done. We are getting weekly basis. We have evaluation form everywhere. We are getting this done. And but the thing is that has to be average out of 10. Then end of this is one extra thing we have to do. We have to conduct before one practical exam. We have to conduct one end of the posting of year, which should be of 5 marks. This is mandatory because this is another separate criteria. So we can't include this in practical exam and we can get that. It has to be done separately and we need to get a separate 5 marks out of it. Then completion of procedures, clinical requirements. Again, it is having 3 marks. So if they completed their file, if they completed their procedure, 3 marks has to be given. So you can have your own criteria. You can have your checklist and you can give the average has to be taken out of 3. So when we total all these things, it comes out of 30. So 30 divided by 3, it comes out of 10. So this is how, so we understood here mandatory module is not added in this. Mandatory module is added only in theory. So that point we have to remember. Here only all ward related things will be included. One extra thing is end of posting, OSCE has to be conducted. Then sectional exam, of course it is practical exam. So OSCE has to be conducted out of 10 marks. So 2 to 3 hours OSCE has to be conducted. DOP has to be done. So that is of 20 marks. 4 to 5 hours it has to be done. So this is a full form of DOP, direct observed practical in the clinical setting. So then we have total, we will get 30. So 30 will be divided out of 2 and we will get marks out of 50. But in the subjects like adult health nursing 1, adult health nursing 2, community health nursing 1, community health nursing 2, this marks has to be doubled because we already saw it is 20 is for continuous assessment and 30 is for sessional exam. So for those 4 subjects, we have to double the marks. So the respective specialty person need to keep this in mind. So I go with this pattern because mine is child health nursing. So I go with this pattern. I have to conduct in 2 different semesters. So I go with this pattern. So, so I hope this distribution is clear. So we will see how I did for first year. So actually this is manned and unmanned. By mistake I kept unmanned only. So manned station 1, unmanned station 1, 5, 5, 10. Then DOP out of 15 I conducted. So when we calculated it is out of 30. Then 30 divided by 2, it is 15 marks. So out of 15, the marks for sectional exam is attained. Now, for continuous assessment, attendance, I have to get attendance mark. Already INC had given the criteria. This is assignment. So I told you with the understanding of the syllabus which first year had, I only gave them these assignments to complete by first semester. Care plan and pressure. So because the syllabus was there in second semester, I gave them that to complete in second semester. So that according to your specialty, understanding and experience, surely you can divide that like that. It will be helpful for the student as well because INC did not divide it in syllabus like that. I mean, the requirement like that. So this is the evaluation form we had. So 10 is the marks in our evaluation form. But when I get the total, then I divide it out of 10 because I want clinical assignment mark out of 10. So this is the average I got out of 10. So this I kept in red because I don't want to add these things separately. I already did everything. I kept here. Now while I will be adding everything, I will be only adding these black ones. So that's why I kept this in red. This is just for my understanding that I added these things and I got the average. Then endoscopy out of 5 we need to conduct. Then continuous evaluation of clinical performance out of 10 has to be done. And procedure completion, that logbook procedure signature and all, and requirements, all the files, these all requirements, whether they completed or not, that has to be averaged here out of 3. Then total we get out of 30. Then this has to be done average out of 10. So this 10 and the previous 15 will be added. So here I can see 11 and here I can see 8. So it should be 19. So see, we got 19 for this particular student. So this is my semester 1 practical, NF1 practical mark. So this I will be adding with my upcoming whatever I will be calculating. With that I will be adding. I will not divide this out of 2 because I have to send the practical marks out of 50 only. So this we need to remember. So this is our last semester, that is 8th semester competency assessment. So clinical performance evaluation. So it has to be done 10 into 5 specialties. So each specialty, how they performed, that has to be done. So 10 into 5 specialties. So 50 marks we will get. ASCII 10 into 5 specialty 50 marks. So total 5 specialty into 20. So we get 100 marks. So that's how we have to. So this clinical performance evaluation, this is the continuous evaluation which will be done throughout their internship posting. This OSCE will be done and during any, like when they are nearing to complete their internship, at that time this can be planned. And that's how we get total 100 marks for this particular set of students. So here till here, I finished today's session, but I want to just do one practice session. So I told already that my specialty is child health. So this is how my logbook requirements have been distributed. So I have nursing care plan 1, case presentation 1, then health talk 1, then we have surgical 1, that is medical, this is surgical. Nursing care plan 1, case presentation 1. So here I gave case presentation, here I made them to do case study. And OPD immunization, so that is one. So this we have growth and development for infants, toddlers, preschoolers. Then we have in NICU newborn assessment 1, nursing care plan 1. So total 3 nursing care plan we can see. Then we have KMC1, KMC2. Then we have nursing care plan for 4 nursing care plan, high risk newborn. So 4 care plan and this module, mandatory module. So mandatory module. So we have 4. So 10, 10, 10, 10, 40. Then again I will divide it by 4 and then I will get out of 10. This 10 has to be added in theory paper, not in practical. So this is my specification here. So I'll just share my another slide because I just wanted to show you how to do this average thing which I'm keep on telling, no, do the average, do the average. Like since first class, everybody is saying you should be very well versed with the technology. So we can't keep calculating each and everything. So what we can do is we can just, so here you can see I kept for 5th semester, there is a model practical which we conducted. So this is for practical examination. So model practical we conducted. So we got the mark for OSCE and DOP. So I got out of 30, then divided by 2 and I got out of 50. So this is the mark I got for sessional exam. Now I want continuous assessment. So I entered my attendance, my students' attendance.
Sorry, Ratna. Ratna
Madam,
ma'am, actually, the slide you are showing, it is the logbook slide, which is
madam,
displayed.
Madam,
You
it's
have
not
showing
displaying?
no,
No?
it's a
Okay, I'll
logbook
see.
slide. Yeah.
It's Excel sheet, it is not showing, madam.
No, it's a slide
Just I
show.
did.
Uh,
Slide show
Rat-
only. Okay, okay.
Ratna, you stop sharing your
Yeah, I will share
PPT
this.
and then
Share
share your
this.
Excel.
Yeah, sure, sure, sure. Sure. So, madam, now it is visible?
Yeah, it's
Yeah.
visible.
So, this is
Yes.
child health model practical. So, here you can see I already conducted DOP, OSCE, got the marks, then divided by 2 and got my 15 marks from here. Now, this is another Excel sheet where I kept my uh, sorry. This is my another Excel sheet where I kept my practical continuous assessment. So these headings are very, very important because we do the things, but sometimes we, after few days, we forget which one we did for what. So these headings, if we keep it properly, it is very easy for us to just add to these things. So this attendance, I kept all the attendance for my students. This continuous assessment, I kept in red for the first years, no. So this I, because in my childhood so many things are there. So what I did, I made another sheet, and for this semester, what I divided like care plan and ICU one, medical one, present case presentation one, growth and development for all the three age groups, then newborn assessment one, KMC one, because we had two KMC. So KMC one health talk. One health talk was not specified in that particular logbook, but in the previous, like all the list of procedures where it is given, their health talk is given. So we need to check these things very clearly, very carefully. That's what I am telling. We need to go through the syllabus very every now and then. Then only we will, like every day we invent some new things. So that's how it is happening. Till now, I am inventing so many things. So so this 9.5, so all these marks. So for this, I have proper evaluation. So this is out of 20, this is out of 10. So like that, this is a case presentation is out of 50. So I have evaluation form out of those marks. But I want ultimately marks out of 10. So what I can do is, there is equals to, I'll press equals to, I'll select the previous, like the total, grand total which I did for by adding that. So this adding also can be done directly by this also. So equals to, and just select all these one by one. Select this one, then do plus, then select this one, and then we will get this grand total. So equals to this one, and then by 240. Many of you might be aware of this thing, but there are few who still need this. So for them, this will be helpful. So into is near 8, the number 8, that star you can press, so that into 10. So, and that's how I get my average, and I can just drag it, and I will get average for, sorry, I'll get average for all the students at once. So this is how I take average for all the things. So I got average this 10 and all, whatever I got, I kept here. You can see here 10, 10, 10, 10, 10, all these things I kept here. Then this evaluation, continuous evaluation of performance, clinical performance, that also marks I kept. OSCE which I conducted, that marks I kept. Then procedure, whether they completed their file, that marks I completed. Then again I have to do total, so that also we can do very easily. Equals to, select this one, then shift plus, then select, then then so like that, we need to just keep on selecting. We need to add a plus, we need to select and then enter. So I got the plus. I'll just go there. I'll get this plus mark and I'll just drag it and I'll get my total of all the, for all the students. So now I want average. So I told you formula equals, select the left side this thing, then divide it out of, so slash, how much is the grand total? 30 into, so star, then 10 and enter. So I got my average 10. I drag this all and I'll get it for all the students. So this 10, this 10 plus this 13. So, this continuous assessment marks from here, I have to select and I have to go to my slide where I want to get, this is the final, you can write heading like final practical mark, and I need to paste values. So this I will be combining. So I got my practical marks for that particular. So this is how we can do it easily, and it will not come at once. I do understand because we also did like that only, but surely we can do. So it's not a very big rocket science. We will be able to do. So that's how I get, and same thing I can do for theory also. I hope I made some points clear to you. Madam, with this I finish with my session. Like if any doubts are there, if anything has to be clarified.
So, Ratna, it's a wonderful session, actually, indeed. And many things are get cleared, especially
Yes.
the format and the way that need to be completed. Actually, Dr. Lalit Kumar, sir, want to ask something. Sir, please unmute
Sure.
yourself and ask the question, whatever you are having.
Good afternoon, ma'am.
Professor, sir.
Ma'am, actually, this is not a question, it's a doubt. It's a
Yes.
problem whenever you are following the INC norms.
Yes.
Like your last sheet,
Yes.
if it is possible, please share this one last your Excel sheet.
That is just an example. Anyways, yeah.
That's why I'm
Is it
asking.
visible, sir? Is it visible?
No, now.
Okay.
Okay.
I'll do. Wait. Just now it is visible, sir.
Till not now. Yeah, no, yes, ma'am.
हाँ,
मैम
sir.
आपने जो नंबर दिए हैं 25 में से 23, 21, 23, 20, अब एक
हाँ,
नया एक नियम जो है वो ये है कि इन सबको जोड़ेंगे और
हाँ,
75 मार्क्स से
ये
ऊपर नहीं
वाले
लेने
आप बोल
चाहिए।
रहे हैं। ये वाले आप
अब
बोल रहे
अगर
हैं।
अब अगर 75 से ऊपर अगर निकल रहा है,
हाँ जी।
क्योंकि ये जरूरी नहीं कोई स्लो लर्नर है, कोई अच्छा लर्नर है, जब कभी हम कोई स्टूडेंट्स को
सर
एजुकेशन देते
एक
हैं
बात
एंट्रेंस,
है, ये तो
तो
एक्चुअली
क्या
में
करें?
बहुत छोटा, नहीं सर, ये तो बहुत छोटा ग्रुप था एक्चुअली। ये बहुत मतलब हमारा एक आईआर बैच चल रहा था, तो उसी का एग्जांपल मैंने छोटा ग्रुप का लिया। बट एक्चुअली में अगर आप स्ट्रिक्टली ये पैटर्न को फॉलो करेंगे ना, आपको हार्डली 60 ऐसा ही आता है उनका परसेंटेज। उल्टा हमें बढ़ाना पड़ता है।
नहीं, अगर
सच
ये
बता रही, मैं
75
4
से
साल
ऊपर
का मेरा
जाता है तो क्या
एक्सपीरियंस।
करें?
75 आप कुछ नहीं कर सकते सर, हम तो नहीं घटाते, हमने इनकी नहीं घटाई।
एक्चुअली कई बार हम
क्योंकि
लोग जजमेंटल हो जाते हैं कि
ये
ज्यादा बच्चों
गॉड
के
विल
ज्यादा नंबर आ गए तो कुछ बच्चों के नंबर
जी
कुछ आए,
जी
कम आए,
जी
तो उस वक्त
जी,
में उस
लेकिन
एज ए मेंटेलिटी हमें क्या करना है?
सर हम
अब वो
घटा तो नहीं
75 से
सकते
ऊपर
सर
तो
किसी के
प्रॉब्लम।
मार्क्स। मैं एक्चुअली कल भी मेरे मन में ये आ रहा था, अगर किसी ने पूछा कि ये 75 से ऊपर हो तो क्या करें, बट हम जो मार्क्स आया है, दे डिजर्व, दे गॉट दैट, वी कांट रिड्यूस, दैट विल बी अनएथिकल। सो आई एम नॉट इन फेवर
Just
ऑफ
for example,
रिड्यूसिंग।
ma'am, if 10 students is only here, okay, some seat is
यस
less, 10 students is there, all are the brilliant students, they are doing very well. अब
यस
हम उनको किसको कम करें?
सर, हम कम नहीं कर सकते सर, मैंने यही
That's
बताया
why
ना,
I'm
ये जो
asking.
30 का, ये 30 का जो बैच है ना सर,
हाँ,
ये एक्चुअल में एक बैच, ये एक्चुअल में
हम्म।
एक बैच है। तो इनका ऐसे ही मार्क्स आ रहा है क्योंकि ये बच्चे बहुत अच्छे से करते हैं, ये इंटरनेशनल स्टूडेंट्स हैं, इनकी इंग्लिश अच्छी है, तो ये बड़े अच्छे से सब कुछ बता देते हैं, सब कुछ लिख देते हैं, सब कुछ कर देते हैं, तो इनकी ना 80 से ऊपर चली जा रही है। पर सर, हमारे प्रिंसिपल सर बोले छोड़ो, अब जाने दो, इनको ऐसे ही रहने दो। लेकिन बाकियों का जो मैं बता रही हूँ, जो हमारे 100 बैच,
तो
130
अगर
बैच के
80% से ऊपर रहने दे तो देर इज एनी प्रॉब्लम विद INC
नहीं,
रजिस्ट्रेशन, स्टेट नर्सिंग काउंसिल और एनी?
एक्सेस तो अभी तक कुछ ऐसा प्रॉब्लम नहीं है, लेकिन मैं आपको क्लियरली बता रही हूँ, अगर आप ये पैटर्न फॉलो कर रहे हैं, बच्चों के इतने आते नहीं,
अच्छा,
नहीं
सेकंड
आते।
वन में
ये
सेकंड वन डाउट मैम।
ये
मैम
हाँ जी।
अगर इंटरनल के अंदर कोई स्टूडेंट फेल होता है तो
जी
एक्सटर्नल में भी फेल होगा और नेक्स्ट टाइम वो पूरा देगा।
यस यस
बट मैम इंटरनल में ऐसा क्या इम्प्लीमेंट होगा अगले सेमेस्टर या अगले एग्जाम के अंदर कि वो एग्जाम देगा? क्या हम पूरा इंटरनल दोबारा दें? क्या उसके
तो
अटेंडेंस वगैरह की उसको दोबारा
इसीलिए
दिखाएं?
इसीलिए हम लोग क्या करते हैं कि अभी देखिए इंटरनल में फेल करना मतलब ये हमारे हाथ में है। तो
हाथ
व्हाट
में
वी
नहीं है,
कैन डू
नहीं नहीं
इज,
सॉरी, हम
तो
फेल नहीं
इसको
कर रहे,
हम
फेल
लोग
हो रहा है।
नहीं लेंगे तो
मे बी
रीटेस्ट हमें चांस देना हमारा काम, उनको चांस देना हमारा काम। तो हम इनको रिटेस्ट करवाते हैं, हम इनको या फिर कोई असाइनमेंट लिख के सबमिट करने बोलते हैं, हम उनको छोड़ते नहीं। ये हमारा it is our responsibility to get their internal improved. We should not we should try to do favor for the students. Only we need to find the way. So what we do is we surely get retest done. अभी फिर से मेरे बच्चे फर्स्ट ईयर के लिख रहे हैं रीटेस्ट, हम उसको ऐड करेंगे वो मार्क्स को, उनको हम इम्प्रूवमेंट का चांस दें। so that we do. So
ये
आप you
मतलब
can
ये
find more
डिपेंड
other
करता है
ways।
हमारे लेवल के ऊपर, हमारे इंस्टीट्यूट
So
के
we
लेवल के
can,
ऊपर
ऊपर
या जो
करता है।
no, sir, actually we can go for a remedial examination based
Yeah,
on the
that's what.
list of slow and advanced learner. तो अगर हम
हम्म,
रेमेडियल करते हैं तो रेमेडियल क्या करेंगे वो हमारे हाथ में है, और उसमें से कितने परसेंटेज हमें लेना है इंटरनल असेसमेंट, विद दैट वी कैन स्टैंडर्डाइज एंड मेक अ पॉलिसी फॉर द सेम, सो दैट इट विल नॉट बी बायस्ड वन एंड इट इज
You
अप्रूव्ड
can,
फ्रॉम आवर बीओएस.
yeah.
thank you मैम।
You
It's a
can assign give some
little
assignment.
doubt, we are facing some problem sometimes,
Yeah,
that's why I'm
even
asking
we
this
do, sir.
expert.
Even we do. But we
Sir,
found that we do a remedial class. We ask them to go for retest, and then we add those.
Sir, I would like to add because it is our own internal responsibility of the institution that every student has to be up to the mark. And if he or she is not doing well, then we have to conduct certain test, retest, as ma'am said. So ये
Actually
हमारी
ma'am, I'm
ही
doing same thing
competence.
whatever you are telling, but just I'm
Hmm.
clarifying
Yeah.
because it's a
Yes,
very
yes.
good opportunity to talk
हाँ,
specialist, that's why मैं थोड़ा सा अपने आप को
Yes,
रिलैक्स कर रहा
sure,
था कि
sir.
चलिए जो मैं कर रहा
बिल्कुल
हूँ वो
बिल्कुल
सही कर रहा
सर।
हूँ।
Then you
थैंक यू
can
सर,
set a
थैंक यू मैम।
standard
ये
and you can
यही
make a
हमारा
policy
एम है।
so that nobody will question you.
Yes.
हम्म।
Thank you, ma'am. Ma'am, there is one question from Amy K, ma'am. For sessional
Uh,
examination of 30 marks, how much time will be given to the students?
It is 2 hours only. It is mentioned in syllabus. 2 hours only.
Ma'am, you are not audible.
नहीं
I'm not on.
नहीं नहीं, you are audible, Ratna. Actually, from the
Correct.
Sharon side, your voice is echoing.
Yeah. Yeah. So, madam, actually, we don't go with the syllabus that pattern because we want the students to adapt to 75 marks pattern. So we conduct 75 marks exam only because they need to learn to write fast. All this pattern also they need to get well acquainted. So we go with that pattern. I think it is there. Maybe it is 2 hours. I am not sure. Surely I'll check and tomorrow I will revert back. So, but we do out of 70 because we want them to be well acquainted with the pattern, the how the marks are distributed for all the subjects.
So you are conducting in 75 and then you are getting the average of from the
As
30, no?
yes,
Okay.
yes. That is our principle. Like we our principle want us to do like so we do like. And we saw no, so many variations are there. How students will understand those variations? So in exam hall they will be panicking. They will be spoiling everything. So we go with 70.
Thank you, ma'am. I request participants if you have questions.
Your
Sorry,
voice
I'm
is
not able
echoing.
to. Yeah,
Yeah.
I'm not able to.
She's requesting to turn on the camera for the
Yeah,
photograph,
yeah,
I
yeah. Sure,
think.
sure,
Yeah.
sure, sure, sure.
All the participants are requested to just turn on the camera. And if you are having any query, you can just list it down. And tomorrow we'll discuss again on this because tomorrow also the session is on examination only.
Sure.
Sharon, once it's completed, please let us know.
As we come to end of today's academic session, I would like to express my sincere gratitude to Mrs. Ratna Tani ma'am for sharing her expertise and practical experiences and valuable perspective on academic evaluation and assessment strategies. Your insight has undoubtedly enriched our understanding. I would like to also thank all the participants for your active involvement and thoughtful questions and enthusiastic participation. We look forward to welcoming you all tomorrow, day 4 of the Faculty Development Program, where we will continue our journey towards strengthening nursing education through evaluation, grading system, and transcript framework. Thank you. Have a pleasant evening. Thank you so much.
Thank you so much.
Thank you, Ratna, once again.
Thank you, Vani. Thank you so much.